My name is Thembi Arries. I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses. I've done this for over the years, and I've successfully diagnosed and treated people with the most complicated of illnesses, which have baffled even the best of some of the medical specialists.
Join us on their journey to better health and renewed hope. This is Dr. Alternative.
Welcome to Dr. Alternative. Welcome to Kabeja. We're enjoying quite a bit of rain these days, and we thank God for that. And in our topic today, we're going to be talking about ataxia.
The brain is the master of giving and managing instructions of body functions. When you chew, it is there. When you button your shirt, it is there. When you sleep, it is there. Virtually in every activity, it is there. Even with your balance to stand or walk, it is there. When the brain gets damaged, depending on the location and severity of the damage, some of these functions get disrupted, and one of those is mobility or balance. One such condition is ataxia.
Some people may be hearing about this for the first time, so make sure you don't go away, and welcome.
Hi viewers, my name is Lorica. Welcome back on the Dr. Alternative show. Hope you gain more knowledge today.
When people send me, some of the people that send me their comments or questions, they always make reference to the fact that some of these topics are really very medical. They're not complaining, they're just expressing their opinion. On the contrary, they're actually quite grateful that we are exposing them to so much vastness of the medical field. So ataxia is one of those topics which I know for most people it may be a very new thing altogether. What is ataxia, and why did I decide to talk about it today? Something that triggered me to do that, it's two people. One is an old patient of mine that I had for about a few years ago, but who has since relocated overseas. And the other one is one of the staff member who mentioned this as one of the topic or the condition that was discussed in her church, and which is just baffling everybody. So I took that to be a cue that maybe I should just cover a show on the topic today. And my diagnosis for this person was not ataxia, but was multiple sclerosis. And that was about, I would say, about 4 or 5 years back. So when he came to me, he was already starting to lose the coordination of the muscles on the right side, such that they suspected that he had a stroke, but because there was no ischemic attack, that was consistent with someone who's got a stroke, so they could not give a conclusive diagnosis that it was a stroke. So he came to me because nothing could be done to correct the lack of the poor coordination on his one side. And then I detected that he had multiple sclerosis. From the medical side, they suspected the stroke, but they could not give conclusive evidence. But with me, it was definitely multiple sclerosis. Now, so I started treating him at the time when he was still in South Africa. although he did not have enough money to cover all the medication. So the legal that I gave him, he was kind of baffled because he said, Thembi, my wife has got a salon a few blocks away from where we stay. I could not go to her. I could not do the things that I used to do because not only the poor coordination, but the fatigue. I would get so tired such that I stopped going to the salon. And he said, but after I took your treatment, the few days after I had started taking your treatment, and I felt energized, I actually walked from our place to the salon and back. And she was actually shocked when she saw me entering the salon. So she said, that's how effective your initial treatment was. Now I have to try and rake in some money to make sure I get the second batch. But unfortunately, he never managed to rake the money, and he ended up getting someone, his relative, who called him overseas in America. So he left for America because he was not generating income at all here, and the prospects were looking good overseas. So over a year or so, I had no communication with him. And then 1 year after that, he started communicating with me, and he said he was actually deteriorating. And he had hopes that because America is a highly developed country, he was hoping that he would have been able to be so much better than even when he left South Africa. So he was asking for help again. So then I said, the possibility of me helping him when he's there, it was kind of almost impossible, because I said the cost of sending medication to America would probably be more expensive than the medication itself, than the meds themselves. So, and even if I were to say you can buy this, there are very few things that are alternative that I would be able to recommend, because I don't know what kind of medication they're carrying on that side. So all I did was to try and assist him with the diet and the supplements. But now, where does ataxia fit into this? After a short while, after a few months, he sends me the results from the doctors. They had done the MRI, they did a whole battery of tests. And he said, in his text, he said, finally, I get a diagnosis for my condition. Finally, I get a diagnosis for my condition. And now I'm asking him, and I say, what do you mean finally? Are you saying that the diagnosis of multiple sclerosis that I had given you was not the correct one? So you've been hoping that they would find you something that, so that was the issue, even though he tried to dodge that observation. But that is what he was saying to me, that now the doctors there, after doing all these MRIs and the whatnot, now they came back with a condition that he has got ataxia. And I'm like, are you kidding me? Are you seriously kidding me? Because ataxia is actually a symptom of multiple sclerosis. So when they say you have got ataxia, they're actually shortchanging you, because ataxia on its own has got something that causes it to be there. So, and as I ask them to contact me, because I'll be able to, to talk to them. And he said, I actually did. He said, I actually did tell them about you, but then I said they can even watch some of your shows. And he said, one of the doctors said, he actually knows about you. I didn't actually believe that. But anyway, he had no reason to lie. But he said, no, that doctor actually knows about you. So the reason, therefore, I am bringing ataxia, because I want us to dissect ataxia and get to understand where am I coming from when I'm saying it is as a result of multiple sclerosis. Yeah. So let's, as usual, we're going to be engaging in the discussion with Lorica to try and unpack this condition. So we're not talking about multiple sclerosis, but we're talking about ataxia. But in my view, or from where I'm coming from, ataxia in this particular case was as a result of multiple sclerosis.
Listening to your explanation, I am confused as to whether ataxia is a cause or a symptom. What is it?
It's actually a symptom, yeah. Even though the doctors, because for instance, besides this particular case of mine that I'm talking about, my staff member, when she came to share this story about someone from their church, that it's the whole family. Some of the family members have actually died, and all of them, they've got the label of ataxia. That and the one they were just bearing one the past week who was also diagnosed with ataxia. Now the other one, who's the youngest, has also got ataxia. So except for the mother, but all the children, including the dad, all of them has passed on except this young one, and all of them have got the diagnosis of ataxia. So ataxia is a term that defines the loss of balance and movement. You know, like for instance, we show the people that have got ataxia how they work. You find some of them, they've got no coordination. Even this guy that I'm talking about, he sent me his video where he was walking, would walk and then stand still, and then walk, stand still as though something is holding him. Not because he's standing still on its own. It's involuntary, the sudden inability to move. And then when he moves, he will move as though you've pressed something. Then you find, So ataxia means that. Ataxia is a term that defines the inability or the damage to the coordination of balance, of movement, because of the nerve damage. Okay. But what causes that nerve damage? There has to be a cause. Because it doesn't mean everybody who's got that problem of loss of balance. Some will even look as though they are drunk. Some they look, you would even say there's like people with cerebral palsy, where you find when they walk, it's not coordinated, it's not neat, it's very haphazard, they're all over, it's not, but it doesn't mean when you've got that problem, it's because you've got multiple sclerosis a lot. It's because in my case, I can see that in his case, it is multiple sclerosis. But these family, for instance, that we're talking about, I don't know. I haven't treated them. It was just something that was shared by one of our staff. But there is something that damages that neurofunction in the brain and ends up affecting that coordination of the brain. Now, you must understand that the brain controls a lot of functions. Even buttoning, even taking the button, even chewing. I'm telling you, even chewing, that's coordinated. That's a coordinated performance. You chew, you see it's a pattern. It's not something that you just do. You chew, you swallow, you open, you close. All that is coordinated. You think it's because you are maybe good or maybe your child is smarter than that one, the fact that she can chew quickly. or she can tie the shoelaces, or she can. All that is a brain function. That is a brain function. And it is controlled by certain specific areas in the brain, in your central nervous system. And when there is something that is damaging that, you lose it. So people, when they are drunk, you find they staggering because the pressure of the toxin from the liquor is disturbing that. So all those things are the function of your brain, your central nervous system. So when there's a damage, therefore, you will find that you'll have one of those, which is ataxia. In some cases, you may find it's not just ataxia. There's another one which is called gait, or where you will just you're not just only losing the balance now, even the ability, the spatial ability to be able to have the sense of space. You know, you are all over. You going there. You going there, just like a person who's drunk. So all those functions are because of the brain. So ataxia is when the brain is affected, and therefore that particular task of maintaining the balance is disturbed. So it is not the cause, it is the symptom. The cause is damage to your neuron in the brain, so which ends up leading to that. So let alone that medicine will just label it as a condition. Like he said, he said, now I've got finally, that's what he used. Finally, I've got a diagnosis for my condition. Are you kidding me? This is a diagnosis? Bring those doctors to me and let them tell me what nonsense are they talking about. Because this is a symptom. Anyway, it's not a cause. It definitely is not a cause. It is the fact that you cannot move. You cannot coordinate your balance. You're falling all over. That's the term. That's what ataxia means. It means your balance is lost. But why is your balance lost? So it's not a symptom. It's just an easy way of medical doctors to give you something, because you must go home saying, because when you get home, they're going to ask, what are they saying you're suffering from? So you need to give them something. They say, I've got ataxia, so at least it gives you something to say at home, so that you can't say, they don't know,
Okay, sorry, Thembi. Before we conclude with this question, I'm actually now confused, because I want to know, is it like a contagious since it is running in the family, or is it like a genuine type problem?
No, ataxia or you're referring to this family where you find that everybody has. It's not a remember, ataxia is a symptom. Okay. But now, of course, a symptom can be contagious. Okay. In fact, a symptom cannot be contagious. It's the cause that will cause you to have that same symptom. Then you end up, we say it's contagious, but it's the cause that always causes the problem. Because the symptom, like when you're coughing, that's a symptom. But what is causing you to cough? So even if they say it's TB, so the fact that you are coughing and this one is coughing, it's the TB that's making you cough. It's not the cough itself that is contagious. It's the TB that is contagious. That therefore makes all of you guys in the family to cough. Yeah. But now coming to this ataxia, whether it is contagious, of course ataxia would not be contagious. But definitely there is a genetic defect that seems to run in this family. Okay. So if you are having that particular gene that is mutating or that is defective, and you give birth to the children, they are all going to end up sitting with that. Because look, for instance, the wife does not have it. So if it was something that was contagious, the wife would have had it also, you know. It's a genetic problem, but it has definitely got to do with, you know, some genetic defect, some mutation or whatever. But I would have, if I were to see this one, I would be able to tell what is the genetic cause, because that's what that's what I have also the ability to see. I will not just see that it is a genetic problem. I will be able to see it is this type of a genetic problem. Yeah. So it's not even then, because remember, genealogy is a very vast subject also. So you may know that it's a genetic, but you know it is a genetic, a defective gene that causes this particular condition. You can't just say, it's a genetic problem. Okay, so why does it affect the mobility, the balance? So obviously it is the type that is affecting the brain, but what is it? Like in the case of this gentleman, this client of mine, multiple sclerosis. From the word go, when he came to see me, that's what I detected immediately. Doctors were saying it's the stroke, but it's inconclusive because there are certain things that don't add up. He comes to me and I say multiple sclerosis. He goes overseas, they say Ataxia. But I said, did you tell them that it's multiple sclerosis? And he said, yeah. They said, no, it's not possible that it's multiple sclerosis. It's not multiple sclerosis, it's ataxia, which is something that I'm used to. That I don't know whether this is something that I also don't understand. Whether when doctors say it is not that, is it because they test and they don't find, or they don't even want to look in that direction because they don't want anything that's going to make them look like they don't know, and Thembi, who's a medical intuitive, has got some answers, or what? I don't know, because overseas, who cares about whether me or not? But they said it's not multiple sclerosis. But now if you look at the results, the detailed results, MRI results that they sent him, I've even made a comment, maybe I can even show that to the viewers also, where I made a comment that the only two things that they identify in MRI scan are also consistent with multiple sclerosis, not with ataxia, with multiple sclerosis. So I even commented to him that, no, this is just confirming, because it's actually consistent with what I'm telling, that it is one of the things that you would find exists or are prevalent in the multiple sclerosis. So ataxia is not a cause, it's a symptom. Let's go for a break, and after the break we continue with ataxia.
If you are fructose intolerant, you should not eat fruit. Otherwise, it will harm your health extensively. This is a genetic disorder directly connected to ADALase enzyme deficiency. Diseases including tissue cancer.
My name is Rachel. I am 35. Well, I was diagnosed with GIST, which is gastrointestinal stromal tumours. It's really rare. It's a form of sarcoma. It starts in the connective tissues, and for me that was the lining of my stomach.
Liver disorders and mental disorders. How do you know if you are fructose intolerant? And even better, what food you must eat.
Welcome back. We are talking about ataxia, which is a condition that messes up your coordination of movement and balance because of the nerve damage. What causes the nerve damage? That's what doctors have to find out. And that's where I give answers on.
Okay, thank you. Everybody knows that dealing with the cause in illnesses is one way of finding a solution. How possible is it in medicine?
Well, it's a big problem for medicine. Seriously, it's a big problem for them to find the cause, because they've got sets of cases where they say we don't know what's happening in this case, but then they've got sets of cases where they say this is what is causing the problem. But when you look at what they define as the cause, then you find most of their diagnosis is still a symptom. Seriously, it's still a symptom. So which makes, like for instance, if you've got consistent headaches and they say you've got migraine, I mean, what is that? Because migraine is a term that is used to define the type of headaches, but it's not the cause. The migraine, it's just like ataxia. So they say, why are you having headaches? They say it's migraine. Migraine is not a cause. It's just a definition of the type of headaches that you're having. But what is causing you to have these headaches? So even in situations where you find they are saying, this is the cause, they say, they've found the cause. It's still not the cause. It's a symptom. It's still not the cause. It's a symptom. But just because they've got all these terms, they've got a whole vast, terminology that they're using. So because they use these terms, then they hide behind these terms to be like giving an answer. Meanwhile, it's still not an answer. They still have to keep on looking. So this is what is the problem, that it's not a case of saying at least, the only place where you find it's guaranteed is when you've got a fracture and they take you to the x-ray. They see you limping or you've got pain or what because you've got a fracture. That is the cause now of you limping, because your bone is fractured. But when it comes to this example that I'm talking about, that you having a migraine, that's not the cause. They still have to look, why are you having the headaches? But now when they say you've got migraine, you find, because they already have a set of medicines that are grouped, and where they say if it's a migraine, you can give this. So now because they say it's migraine, then they're going to start picking from the list. And if the headaches, they subside and they come back and they subside, they will keep looking in the list. Then they change, they give you a change. But it's still not the cause. So it's a big problem for conventional to be able to fix that part. And this is one area where I actually approached them. I did approach them, some years back, the Association of Doctors, and I say, hey guys, I want to help. I'm not going to take your patients away from you. I'm just going to assist you to diagnose so that you're not sniffing in the dark. There's where the droplets of the dog are sitting there, and you're not going to keep sniffing all over the building to find where is that stench coming from. So I said, that's where I wanted to help them. I still want to. So it's still a big problem. Yeah, it's still a big problem. Seriously, I don't know if they're ever gonna fix it if they don't change their attitude.
Thank you, Thembi. In this example of this person who was diagnosed with ataxia, would you be able to help him regain his health?
Well, I'm going to talk about this one of mine who's diagnosed with ataxia, but who I diagnosed with multiple sclerosis, because I know what's happening. Like I said, I already started before he left for America. And as I said he walked from their apartment to the wife's salon and back. And they were both shocked how he managed to do that, because that was done and dusted. So I had already started. Because remember, multiple sclerosis, as the short is showing, it's a damage to the protective cover of the nerve fibers in your brain. So now the question is, when that protective cover is damaged, where are the chances of putting it back again? So even in medicine, if you're fortunate that they discover that you've got multiple sclerosis, and also you must understand, multiple sclerosis does not only cause issues with balance. It affects your optic nerve. You find some people may have seriously compromised vision. It affects your respiratory system. There are people who are maybe seen to be having asthma because of multiple sclerosis, which is not diagnosed, because if you're presenting with asthma, they're going to keep on giving you treatment of respiratory issues. Meanwhile, there's the multiple sclerosis. It affects, and now remember, it's not just only affecting the brain, it's affecting the spinal cord, because central nervous system is not just the brain, is the spinal cord as well, cranial area and all that. So you find it will not just be the balance that maybe all of a sudden you cannot walk, there's no mobility at all. You haven't fallen or anything, but then you find it's like you're paralyzed. It affects your sexuality. People have got total erectile dysfunction because of the multiple sclerosis. It causes a bunch of problems, serious bunch of problems. It may even cause cognitive decline. You find the person was fine, but now you find even when you can see there is some decline in their cognitive abilities. So it affects a whole lot of things, which you may not even link to the brain, because like I'm saying, if you've got erectile dysfunctions that respond to nothing, you may think, it's diabetes, or or maybe they've bewitched you, or that woman that you cheated with, because people say these things, that no, because I cheated with this, and then, now I find it. Meanwhile, you can see the cause for erectile dysfunction. So what I'm getting at is that you because it has got such a dovetailing of symptoms, you may lose the ability to go where it is up until you give up. Okay. But in my case, because I can see, there's where the culprit is. So I start there. But now where I was coming from is, people may wonder, how possible is it that the protective cover has been damaged? How possible is it to put it back again? And shockingly enough, I've treated lots of people with multiple sclerosis. I had a lady from Congo, who was brought in by his brother, because the brother was just fascinated. So she came in from Congo, and I was just giving, and her symptoms had nothing to do with coordination. But these symptoms of this, because you find there are people who are in pain, just pain, pain not because they pricked themselves on anything or they bumped but they're just in pain, what we call fibromyalgia, because of the neurodamage. Some have got loss of sensation on the feet. They're walking, they can't even see the shoe is left behind if it's a slip-on. So those are the things. So what I'm getting at is, I've treated people with multiple sclerosis. Shockingly, to a total reversal of the conditions. But now, coming back to how would I treat this one? As he is there, I said to him, because I cannot send the medication without you breaking your neck. I mean, it's almost silly to say, because when I give meds, like people know, it's a box, it's a big box. So now for that box to go overseas, how much will it cost? Like I said, it will cost more. The courier will be more expensive than the meds themselves. So I said, it would be silly for us to. But then I said, he sent me, I started advising him on what to do. And I said, I'm going to start with the diet. I said, I'm going to give you a week, 1 week, in which I'm going to detail that on Monday, when you get up in the morning, this is what I want you to do. Starting with water. Give an example. That as detailed as this is what you must do. This is what. So I'm going to show to the viewers that I just gave him 1 week's program to kickstart. And I said, from this, but then I asked him to give me the list of meds that he was taking, and he was taking, a serious pain management condition. I mean, the medication, because he was in a lot of pain because of this multiple sclerosis. So this is how I started working with him. But then if you look at the detail of what I gave him, it's very detailed and it's expensive. Because if I say you must buy salmon is expensive. And you're only going to have maybe tomorrow you're having, So those type of things, if you look at it, it's an expensive program and it's just 1 week. So going to 2 weeks, I change again. 3 weeks. So I said, look at this. Is this something that you can think we can start off with? Because it needs, your wife must be able to prepare this, if you've got a helper, and so on and so on. So even without medication, just with the diet following, because people still take it light that food is medicine. People still don't wrap their brains around that food is medicine. That only by just sticking to food, but then you must be able to give the body exactly what it needs. The supplements, because our food has got a serious nutrition depletion, so you find but then I guide you what supplements you must take, and then this is what I want you to do on Monday. So that's how I started with him, and I said, if you can manage to do this for 1 week, then I can move to the second week. But if you cannot do it, let's not even start, because that's the treatment that I was recommending for him in a case where I could not send him medication. But otherwise, the turnaround, I promise you, if you look at the list, at the detail of what I gave him, you will actually see that. This is what I do. I mean, I've mentioned about one particular patient who had a stage 4 cancer, and then he was discharged to go to palliative care, but he was in so much pain, couldn't sleep. They had given me the highest dosage and a potency of pain management. And it was still going beyond that. I mean, he would not feel any difference. They gave him patches so that if it's too sore here, and then he would put a patch or whatever. But all that was not helping. He could not sleep. He could not. So all I did was start with him. I start him on what he must take, what smoothies he must take. What supplements, like for instance ginger, to take away the inflammation, and how to prepare the ginger, Not just ginger, but where to get the ginger, how to prepare it, and a whole bunch of things on what to put on smoothies. And the wife, she said, I cannot believe that. The pain. It's not like there's a little bit that's left. She said the pain is totally gone. And she said the deep sleep. She said he's not just sleeping. He's sleeping so deeply, so deep that even when and he's snoring, and she said the snoring is not the it's a very some kind low tone kind of stuff. And she said, I did not give him medication. All I did was give him these supplements and give him these smoothies and give it in this manner. And I even stopped him from taking some of the pain medication that he was taking. I left some, but removed the rest. So what I'm getting at is food is medicine, Dorica. Food is medicine. So in most cases, that's why you find that the thing that I'm doing now with people is that before you start with your medication, I make sure you're going to take these supplements because they represent food. They're providing you with nutrition, but the type of nutrition that your body needs in that particular state. So that's why you find I'm quite strict now with making sure you take supplements before you get into treatment.
So what are your advice to the viewers about the ataxia?
Well, the advice that does not just only refer to ataxia is that I've got to see you. I've got to scan you, even though I also do online consultation, but it's because I can pick up, but I've got to scan you to be able to see what's happening, because this example that I'm giving, for instance, of my client, he is presenting with ataxia symptoms, but he's got multiple sclerosis. So there's no way you can think you can try to fix the poor coordination, because even him, it's not like they're giving him anything. They've just told him, this is what you have, but it's not like they're saying, this is what we can do to fix it. Even though there you find that he goes to physiotherapy where they say, okay, if the myelin sheath, which is the protective cover of the nerve fibers, is buckled, no matter how hard you try to, you're wasting your time, because you've got to fix that, because that thing is naturally there. God placed that protective cover there. So when it is open, no matter how hard you try, those nerves are exposed. So you've got to try and close it. So that is why I'm saying, therefore, the solution for people who are sitting with unexplained or undiagnosed conditions is for them to come to me so that I can see, why are you having this problem? And also, people know that you will come with a problem of poor coordination, but I'll be able to say, you're having poor coordination, and you're also having this and that, which you know. I mean, you must know that when I tell people additional symptoms that they are having, I'm not talking something that they don't know. They know. But it's just that it was not something that they thought was connected to this. And this is the thing that's worrying them the most. But it's not because they're not aware, like this example that I'm talking about, that multiple sclerosis, but you're sitting with a lot of pain. Okay, they say it's because of ataxia. But then where does, or sexuality. Why is my sexuality so bashed? Because it's multiple sclerosis. But because you did not know there's a connection, you're linking it to something else, So what I'm saying is, come to me. I will be able to detect what's going on. That's the advice I'm giving you. Come to moi. I will be able to detect what is causing the problem. Whether I end up, if you don't have money to buy the medication, but I end up advising you on what you can take so long, what supplements, what smoothies, what diet you can follow so long while you're raking the money for medication. But you'll find that it will shock you that you'll actually realize the transformation that you never expected, just from the supplements and the diet. So, what am I saying? Come to moi. Come to mama. Then you will get the answers. So yeah, that's my advice, Elorica.
Yeah. There's something else I wanted to ask now. We were talking of drunk people that also lose their ability because of the liquor. I don't know what it is called in English or in Xhosa, but in Afrikaans we normally say they get a tongue. You see, when they overdrink, and then there's a time that they just pulling stuff. Yeah. They can't even talk properly or walk.
Of course, because that's the brain. Remember the speech.
Yeah.
People who've got stroke, you find that they lose the speech. So the people who've got stroke, they lose the speech. So the brain controls so many functions, it's scary. So when you drink, therefore, you are affecting the part of the brain. In fact, I don't know the liquor, where it goes in the brain, but those functions where it goes to, the back, because the back part of the brain, that's where your balance is controlled. That's where your optic nerves from occipital lobe, that's where it's sitting. That's where the basal ganglia that controls the voluntary movement or waving or whatever, that's where it's sitting. That's where your speech, that's where it's sitting. So there are so many functions that sit in your brain, particularly the back. Okay, so that's why you find even when it comes to driving, a person will say, I see 4 streets, the road seems to have been divided into 4. And then one was telling me that, and then I say, how do you know which one? Then you must follow. He says, I just follow the one that is in front of me, and I ignore others that are just spreading from that one. So
it's crazy.
So that's how that's the brain. So that's what liquor does. It really messes up the brain, and therefore.
So it has nothing to do with ataxia.
No, remember ataxia, as I've said, it's itself, because when you're drunk, you look ataxic, you lose the balance, Yeah. But it doesn't. But it's a temporary interference.
Yeah, because they later come back.
Once the effect of the liquor is gone, then you find you're fine. So, but at that time, it's really sitting on that nerve, a fiber. So that's what happens. So the brain. That's why you find when people get a car accident, that messes up the brain. That's it. When the brain is damaged, that's it. So because all the functions, they're controlled today. So the brain, you must look after that brain. Let alone that gay people don't realize the importance. The drinking, they don't realize that. Anyway, that's where we're gonna end our show today. Where must you go? To moi. So if you wanna know what's wrong, because these symptoms, the doctors are saying, Hannah, I will tell you what's going on. You can go back to your doctor and say, Thembi is saying this is what's happening. And they can treat you if you don't have money to buy the treatment for. Okay? So if you've got more questions or you need more clarity, you can either send us emails, as most of you do already, or you can send some comments or questions to your Facebook page, though to our Facebook page. Those that we can answer directly, we will, but those that we feel for the benefit of other people that may not have asked, we can just present a show on that particular topic. Thank you.
Thank you, viewers, for tuning in. As you've all heard, welcome to Mama.
Well, that's where we end our show today. I hope you've learned something from it. Anyway, people are really commending us for the way we educate and inform them on this show. And thank you for those comments, and thank you for watching. Goodbye.